From the Alliance for Camp Health, this is Elevate and Relate. I'm John Hamilton. Every summer, kind and care-centered healthcare teams step into the life at camp, whether on a campus or at a day camp or overnight residence. You step into this environment where healthcare providers are managing acute care, supporting chronic conditions, and preventing illness. They also run a complex system of documentation, communication, education, and response time that shape outcomes as much as any single clinical decision. Today's show, how a pediatric nurse and camp health leader, and also an ACH SHAPE task force member, brought hospital-level quality thinking to the health center. We talk about the first evidence-based set of quality metrics for pediatric residential camp health services, what camp directors can do with the data, and why staff well-being belongs in the same dashboard as camper care. Stay with us. Joining us for today's episode is Kate Finlayson, the Director of Health and Wellness at Camp YJ and one of our very own Camp Well facilitators. With extensive experience in pediatrics and after working in a variety of settings at major hospitals across the country, Kate is eager to join the camp community to manage the health center and oversee the medical care of all campers and staff. A member of DAILD 95, Kate now enjoys watching her two boys grow and thrive at Camp YJ as well. And when not at camp, Kate lives in Wayland, Mass, just down the road from where I am, with her husband, Alex, two sons, and her Australian Shepherd, Nix. Kate, thanks for joining us today. Would love for you to just share a little bit more about your role at hospitals around the country, and more specifically at Boston Children's Hospital, and how you came into camp health research.
Yeah, thank you for having me. This is such an honor and a delight to do in the beginning of the year. So I've been a pediatric nurse for over 20 years. I've worked in a variety of settings. I've worked in NICUs, in cardiac ICUs, interventional radiology, and the recovery room. For the most part, it's been all at Boston Children's Hospital, but I've gone from San Diego and Denver. So I've worked really all over. During my time, most recently in Boston, I have had the opportunity to work on many committees, and that's involved research projects. And I really shocked myself when doing the research by how much I loved data. I never thought of myself as a numbers person or a data person. But when I started looking at data from the lens of a nurse and projects that were meaningful to me, I just couldn't wait to understand the story that the data told. So that's really where my love for research started. In terms of camp health, I went to overnight camp my whole childhood into my young adulthood as a counselor. And my two kids go there. My niece and nephew go to YJ. It's a place that's so meaningful to me. And so a few years ago, when I started working part-time at camp, it was honestly to mitigate some costs for my kids going there, and also to be a little bit like Peter Pan. I don't want to grow up. I want to go back to camp. So that's what brought me to the health center. When I started there, I really was attunely, because of my experience in a well-oiled machine like Boston Children's Hospital, I was struck by the opportunity to bring some standardization to the camp health space as well. And I really enjoyed that in a part-time capacity. After a couple of years of doing that, luckily the YJ leadership team wanted me to work in a more full-time capacity. And I really jumped at that opportunity. I knew it was a way to merge all those things that I love. So nursing leadership, camp health research, and that's how I became the director of health services at YJ.
Amazing. What a cool journey. So today, as we look to elevate and relate, there's so much to relate to, I believe, for listeners tuning in. And there's things that we want to talk about in your work that you are elevating for us. And so I just want to first and foremost say thanks for joining us as a camp nurse, as somebody who's paved a way at a camp, and I don't know where or how your leadership decided to become committed fully to the work, for you to blend what you're doing at Boston Children's, to be a mom and to infuse that into the work. There's so many different paths that we can consider, but we're gonna primarily hone in a little bit here on the camp health metrics work that you've been doing, just to start. Because when I heard that this was work that you were doing from our CEO Tracy Gaslin, Dr. Barry Garst, who's our research chair, I was like, we've got to feature Kate in this work for so many others to be able to do. So can you give us a brief overview of that? And then we'll tap into some of the other things that I think people can relate to from the seat that they're sitting in at their health center, or as a healthcare provider at camp.
Yeah, absolutely. So, because of my passion for research and data, as nerdy as that may sound, I was accepted into a 2-year nursing science fellowship at Children's. And that was before I was offered this role, this year-round role at camp. So I started that, and of course, because life, then the camp opportunity came. And so I accepted that role, like I said before, jumped at that opportunity, but really was at this crossroads because I wanted to stay in the fellowship because of everything that I've discussed with research and having the backing of Boston Children's. I knew would be super valuable. And so luckily, again, my leadership at camp, they also have, they see health and wellness as a core priority. And they chose to invest in my participation with that. So
Good for them.
Yeah. They also, even getting this position in the first place, it's a year-round position in the health center. And that's not universal. I don't know many camps that have that. And so our pediatric population, the complexity continues to increase. So the role needs to really, in my opinion, be more than seasonal. We need to be speaking with physicians and parents and therapists and pharmacies. There's a lot of off-season work to be doing, but I digress. So they luckily sponsored my participation in the fellowship with the end goal of having a really robust research project that addressed an issue of camp health. So that's sort of how I started into this whole research fellowship in general.
I love the way in which the passion that I've seen from you from the very first moment that we met for this work continues to be something that I think will inform as you share more today, but I think for us in the future. And so one piece that I resonate with as a dad who's had children who've benefited from care at Boston Children's. Thank you for your work there, and I just want to acknowledge and give a shout out to you, because I think they do so many amazing things within their space, and I believe that complements well with the amazing things that we're trying to do within the camp space and all of the healthy benefits that come from it. But before we go too far, as a parent, as a mother, as a childlike, spirited individual who wants to channel Peter Pan, I want to also just take a moment for us to just relate before we get too far into some of the details that we're chewing on about your work from this health metrics project and whatnot. Can you maybe just share a camp-friendly joke for everybody that we could relate to?
Yeah.
I'm just curious if you have anything. That's something that we do within Elevate and Relate as we continue to build this out.
Yeah. And of course, it wouldn't be a joke from the health and wellness, director of health and wellness, if it didn't tie back to some way a health-related camp joke. So where do canoes at summer camp go when they're sick?
Let's see. Where do they say? I'm not sure. Where do they go?
To the dock.
Oh,
I mean,
good.
I really had to go to the depths to find, to remember that one.
Yeah, I was thinking out to sea or out on the water somewhere. I'm like, where do they got to go? To be Portage. That's good. To the dock. Oh, sweet.
Yeah, which really kind of doesn't bring the nursing side of it in, but that's okay. We're all one team.
Yeah, definitely. So I think that's something that you're highlighting and that we can relate to beyond coming to the doc is recognizing the significance of expertise in various roles. And so I'm curious, as you think through the Camp Health Metrics project and where it began, what questions were you trying to answer And
Yeah.
why are those questions relevant to, yes, healthcare providers, but also to a potential executive director or camp director, administrator, leader that's tuning into this?
Yeah, that's a great question. So, starting with the question that I'm trying to answer, from working in both the hospital and the camp setting, something that was really important was revealed, and that is that camps provide essential pediatric health services. That includes acute care, it includes chronic condition management, illness and injury prevention. But unlike that hospital or school setting, camps really lack the standardized quality metrics, which made
Mm,
it difficult to benchmark, to evaluate programs and interventions, or to improve health outcomes. And so it was very clear that we needed some metrics by which to evaluate programs and guide interventions, and evaluate whether the interventions were successful or not. But what it
mm,
means to a director is something that I've thought a lot about, because really they are sort of the endpoint in carrying out and green lighting this work for camps. But this work helps leaders understand that camp health data, it's it's not about the medical minutia or the details. It's really about leadership, risk
mm.
management, staff support, and really the camper experience. And that data makes so much of the invisible stuff that we do, or that invisible aspect of health, it makes it visible or tangible. So it turns the daily health center work or workflow into something that you can plan around, staff for, and improve. And so ultimately, one of the goals was to help camp leaders move from this reactive standpoint to proactively designing healthier systems for staff and campers alike. So it's that gap that really sparked my research.
Yeah, yeah. And so sitting in that seat where you're full time year round and that the camp is your camp, YJ has committed to that. Like again, props to leadership and the dedication to say we need expertise not just in the summer but year round in this. That gives that lens for you. But I think there's something that you identified. You said camps provide essential pediatric health services. And I think that like just trying to translate what that means in terms of the space that we are hosting, ensuring care, elevating what that looks like. I think that that's a piece uh, where we need more insight. We need more of a commitment to double down. And so I just love how you've phrased that and that we need quality metrics from a safety and risk management standpoint to be able to identify the best path forward there. Is there anything else that you'd say to that in terms of like translating what you or others might understand? I look at it from like a chief medical officer standpoint, like at a hospital, like understanding, okay, this is all of what we're encapsulating. So for a leader being in that spot, like essential pediatric health services, that has so many potential benefits for each and every single individual that you are providing an experience to or care to. Uh, but
Yeah.
but yeah, can you talk a little bit more about where and what uh, your initial question, where there might have been a gap and what was sparked in your research as a result?
Yeah. I think that, we there were so there's the complexities. And so there's medication management, which has gone from, when I was a camper, a tackle box in the park of camp because maybe two kids were on meds, to file cabinets of medication because so many of our campers are on medication, my kids included. There's nothing wrong with that. In fact, there's everything right with that. That means that conditions are being managed. But that also means that we need to have robust systems in place at camp to continue the management of certain medical issues as well as mesh issues. So it's not just the physical, it's also the social emotional stuff. And so I noticed at camp we were, say, putting new systems in place, but how did we know if they were working or not? We didn't have any way to measure the before and after, the before, during, after. And
Right.
so it felt a little arbitrary, like we could feel, and we're feeling people in the medical world a lot. So like this feels better, but that's so subjective. So what's a standard objective way that we can measure how we're doing? And the goal was not to say your percent of URIs, upper respiratory infections, should be below or above or in between. We're not giving the goal isn't to say you're doing poorly or you're doing great. It's to say, okay, this changed from this year to this year. What could have caused the change?
Mm,
Or this has consistently been a sensitive spot or a blind spot for us. What can we do to maybe help that? Or what analysis can we, root cause analysis can we run to see why this is happening? The goal is
mm.
definitely not to be judgmental or say you have to be here or there or anywhere. It's more for each camp to individually say, all right, based on these metrics that we use every year, how
Yeah.
are we doing?
So then, yeah. So I love the piece that, like, it's not a matter of being judged or graded in terms of this within your research, but to just bring more information to guide how
Yeah.
we can adequately, as we say within our end statements, build a more robust body of knowledge that directs the health services that are taking place at camp, or where and how we're looking at intentionally designing the camp experience to promote well-being. And so, what are you learning? What are others that have been a part of the study with you learning, and how did you get there?
Yeah. So I love talking about this. So it was important to me to find a way to do this research to get this final list of core metrics for camp health centers to track for their own camps. It was important to me is to get a pretty varied makeup of people in this professional health. What did I say? The residential camp health experts. That was the panel. So we tried to get people from across the country, varying ages, varying experience, years of experience in the field. Certainly, we had some guidelines, like you needed to have worked in the camp health center for a minimum of 2 consecutive summers. And so after a lot of recruiting, we came up with this panel of residential camp health experts. And what the initial work was that I, through the review of the literature and the help of Tracy Gaslin, who is just amazing, she and I
I
together came
agree.
up with this, right, this initial set of metrics. And the process was that everybody on the panel got the initial as a survey. It's called this E-Delphi methodology. Basically, it's this iterative round of surveys that continue to go on until consensus is reached among that group on the final thing. So for
Super
us, this
helpful.
final
Yeah.
list of metrics. Yeah.
Yeah.
Um, so the panel got that initial list of metrics that Tracy and I came up with. They ranked each individual metric on this Likert scale of 1 to 5. So 1 being not very important, 5 being extremely important. And then we used criteria. Well, let me back up. There was also an open response box for
Yeah. Yep.
for people to suggest metrics that maybe we didn't list that they
Hmm.
thought would be important to include in the next round of the survey.
I love the approach
So
to from the
yeah,
consensus with Delphi to the Likert scale, but also leaving that open-ended piece. And so, yeah. Okay. So
yeah,
then, what
it was
what are
important
we?
to admit that we don't know. We're not an exhaustive. I wanted the input of that from them. So these rounds continued. So they would fill out the survey. We would analyze the data, and certain metrics may fall off from round to round, as well as the metrics that they were proposing in that open response box were added in. So we ended up doing 3 rounds until we reached consensus on a group of metrics. Um, and it was a really interesting, fascinating actually process to see the suggestions that people had in that response box, to see how that list evolved. um,
Right.
and I'll get into this a little bit, but the thing that was the most surprising to me is we started with a very clinically driven list of, number of campers you evaluated for concussions and number of orthopedic injuries, very clinical. And
Yeah.
what we wound up with from this consensus, after we reached consensus, is a more systems driven list of metrics, which was
Mm.
fascinating to me.
Yeah, yeah, I think that is fascinating because there's a way in which the systems that we have upheld for traditions or for certain reasons, we've seen in different ways. I know that when bringing my daughter to Boston Children's, what that looked like 10 years ago, what that looked like 5 years ago, what that looks like today for essential health services to be implemented, we have to continue to evolve. And so I guess I would say, like, as somebody who's learning from you just in the midst of this conversation, and what you're taking away from a very well thought out clinical approach to this research and study, what would you say to somebody who's listening and tuning in and going like, well, I don't really care about the data as much, or I'm not really wanting to innovate at my space. Why is this of interest to them?
So let's see. How do I begin? I think that the shift, especially from this clinical list to a more systems based list, it reflects how health centers truly function at camp.
Mm,
It's a multifaceted system of prevention, coordination, and communication. And so, for people that maybe don't care about the data, I'd say that's okay. You don't need to be caught up in the data. It's really about looking at the overall picture, because when you are able to just take this core set of metrics, it highlights that, how do I say this, the documentation, communication, pre-camp forms, that those are the robust things that will allow a camp health center and therefore the camper experience to be optimal. Um,
I love it. That's spot on. I think that is, we want that to be optimal. I don't think that anybody within the industry in any way, shape, or form, and in whatever type of camp. I mean, I know that this is specific for overnight residential because of the life and the experience, but I don't think anyone would contest or contend with what you're saying there. We want that to be the case, and yet it requires us to continue to make some adjustments. So what are the lessons and or themes that are coming out of the study from everybody that participated, and what are you learning?
Yeah, so I would say the first lesson that I saw, like I couldn't even wait to get to it. I already got to it. Is the clinical to the systems based metrics that we wound up with. So that was an interesting lesson for me.
Hmm.
And then the one that I also found interesting was the expert free text responses, how much that was utilized. People wrote a lot in those
Mm.
open text responses. And that showed me this strong desire for this shared language and professional community among the camp health professionals. Um, it showed a real gap, I guess, in that camp health professionals want shared spaces, to collaborate, to share ideas, and just to build this collaborative and collective knowledge with each other. I got things in those empty or those open response boxes that weren't even proposed metrics. It was like, and here's what else we're dealing with. And it was fascinating. I loved all of it because it was like, number one, it's like, oh, yes, okay. So the problems that we have maybe, are universal. And it was also this moment of like, okay, that's not something that's happening at my camp, but something to be aware of and something to investigate and explore a little bit more. And that collaboration, there's real value in there. So I definitely
Mm.
want to do more with that in the future. But in terms of themes that we're seeing too, is that
Yeah.
camp nursing specifically, it's this unique extension of pediatric nursing science, and one that hasn't really been tapped into a lot. It expands the pediatric care to a non-traditional setting. It's not a hospital, it's not a clinic, it's not a school. It's really a non-traditional, for the most part, under-researched place. Not to say that there isn't wonderful research out there. It's just
Right.
not extensive. One person, Barry Garth, can't, do it all. So there's good research out there. It hasn't been studied, well throughout by lots of individuals or organizations.
Which
Um,
all that I'm hearing you say is that it's bringing more credibility to our industry, right? And so for
Absolutely.
somebody who's been an executive director at a camp, I'm like, oh, I wish that I could participate in saying there's ways in which the camp experience, if this certain level of care is being offered, we can extend what is happening in other clinical spaces, right, for young people, for children, in those ways. And so, is there anything that came out in terms of the ways in which to standardize these metrics for readiness in some capacity?
Well, yeah, I mean, I would say that this is really more of a foundational study,
Okay.
and it should really be used as a springboard for future work. But what I would love is to more widely share the list of metrics that we did come up with through this research so that they can be adopted nationwide.
I love it.
But to your point, I also want to shout out the mesh part of this mental health part, because I think historically and maybe even traditionally, when people think of camp health, they think of the physical aspect of that.
Yeah.
But a lot of our campers, and where some of these metrics are focused, have to do with mental health issues. And that is a key component to the camper experience.
Right.
Physically, if they're fine, but are having a real, say, mental health crisis, that is not going to, that where they're not supported appropriately or at all, that's
Yeah.
not going to lead to a positive camp experience. So this has to be the whole being.
Yeah, and that's a piece. So I think that within our Alliance for Camp Health work, you know this as a member of our Safety, Health, and Prevention Education Task Force, our SHAPE Task Force. We're looking at clinical care and we're looking at relational care. And there's certain parts for you as a nurse or healthcare provider where you are going to have to provide that support in the moment for the well-being of the child that you're with. But they may need more clinical support from a mental or emotional, social, spiritual health standpoint from somebody else that is not you,
Mhm.
but at the initial point, it's there. So are there any things, or how might your findings be intersecting with both our safety, health, and prevention SHAPE framework and or our Mesh Plus framework? Are there things that
Yeah.
you're finding, and what are they?
Well, and let's talk about shape first. These metrics directly support shape, the shape foundation or framework, by providing these measurable indicators in all three of those pillars. So in terms of safety, accurate documentation, emergency response rate, and visit classification patterns fall under that safety pillar of shape.
Okay.
In terms of the age, the health, illness visit tracking, that was one of the more clinically driven metrics. Repeat visit monitoring, and chronic condition management. Those fall under that age. And then in terms of the prevention education, this is one of my favorite places. That are metric about pre-camp forms being completed,
Yeah.
staff training quality, and communication with counselors. That is really that prevention education. So
Mm.
this really, shape offers really the framework, and the metrics offer the tools to evaluate and strengthen it.
Okay. Excellent.
um, in terms of the intersection with mesh or mesh plus, that focuses on the mental, emotional, social, spiritual health dimensions of youth development. And that's really the relational heart of camp. That is what makes camp camp.
Mm.
um, One of the most revealing metrics from this research, is the number of staff visits versus camper visits to the health center for illness or mesh concerns.
Well,
Um,
that's yeah. Say more about that. I'm really
yeah, so on
intrigued.
the surface, that looks like a simple count of visits. It looks very like, okay, we've had X amount this session. But for leaders, this can point to bigger issues: fatigue, environmental factors, unmet needs of staff. It really gives directors an opportunity, to intervene upstream, I guess is the best way to say it. Intervene upstream rather than in reaction mode. So if
Hmm.
we can say that, week 3, staff was showing up to the health center with a lot of, anxiety, any of the mesh concerns, that's something that is good for us in terms of metrics. We can say, oh, this is a pattern. Oh, this is what we saw, this uptick in staff, mesh concerns week 3. And then we can,
Yeah.
then for the next summer, know that's where that upstream sort of prevention comes in. How do we support that and cushion that and or prevent that?
Yeah,
Um,
because we know it's going to have a direct impact on the experience of participants, on the camper experience, right? And so like there's
it's
a
a
way in
whole
which,
ecosystem.
yeah,
Yeah.
and so it's, I mean, we've seen that across the board with the organizations that have participated in Campwell, right?
I was
Getting in
just going to
front and
mention Campwell.
okay,
Yeah.
I'll let you do it. You share.
No, no, no. To your point, I mean, I think you hit the nail on the head that if our staff is not feeling safe, supported, how do they make others feel that way in that setting? We
Mm,
have to take care of the staff. We are not just camper focused, because things will fall apart if we don't have strong healthy, well staff to take care of the campers. It
Yeah.
doesn't work. It is an ecosystem. We all affect each other, and so it's really the Mesh Plus. It's not just a community. It's not just a camper framework, is I guess what I was saying. It's a community framework
Mm.
because staff mesh needs directly impact that camper experience.
It gets at the entirety. I mean, this is the piece that I think is fascinating, right? Is that your research from a clinical care standpoint is saying, okay, from a dimensions of care standpoint, there are things that we need to promote that are health related. There are things that we need to do. You're saying it from an intervention upstream becomes that prevention. And
Mhm.
so when we start to think through the ecosystem as a whole, it is why whether or not we have a healthcare provider tuning in, we have to all continue to advocate for expert lenses at any given point in time in this work in order to elevate care. So I want to jump into what we call within Elevate and Relate our elevating care segment. And so in this segment, I want to ask you to share kind of some specific actionable strategies that are helping to change how we think about the standard of care or where and how others might be able to elevate care as a result. So, what are practical ways that camps are starting to use these camp health metrics in their programs? What are ways that they can
Yeah.
go? Okay, I'm going to take this away today.
Yeah, if you look at it, as a whole, it can be sort of daunting and intimidating. Like, oh, I have to track all of this, and there are all these metrics. But you could start simple. So, starting with just a few metrics. So, documentation quality, response times, illness visit classification. I think is a real one of the easiest ones. Okay, what were all of the health center visits that we saw, and let's classify them by illness, by injury, by is it upper respiratory, is it stress, and just looking at those patterns. And then the mesh visit tracker, just sort of data that you're already collecting because we're all documenting on visits to the health center.
Yeah.
Use that data that you already have and just sort of classify it and evaluate it. That's one step.
That almost sounds. I
Really,
just I
yeah.
just want to identify. I think what you're saying because earlier on you shared that there's a consensus and a language that in this process those that were participating wanted there to be something more consistent, and that's what I mean. I almost am envisioning a form that is identifying Shape or Mesh Plus as a part of that documentation to bring some of that consistency. Sorry to interrupt. I want to
No,
continue to learn, but I'm just
absolutely.
light
I
bulbs
think
are
if you
going off.
can, no, it's great. I think if you're using something like a Google form or Excel spreadsheet and you have like the shape, what each of them are, and then the mesh, and then track what the visits fall under and where those intersect, or use the metrics, sort of classify the metrics, and then use that shape and the mesh plus to say, what does this fall under and what bucket almost can we put these in? And it may fall into more than one bucket, and that's okay too. But I think that will be interesting to see where things sort of track. Um,
Yeah.
and I think it's really important to share the these trends that camps are seeing through the metrics with the leadership. Camp
Mm,
leadership needs to know because they're they're going to be the ones that are saying, oh, wow, I didn't realize that this is what's going on in the health center. I didn't realize that this is what's going on with the mental health of our campers. Let's put more resources into X, Y, and Z.
right.
Um,
Right. Yeah. And what I love about that is that there's more specific information that's being prioritized because you're capturing the information. So it's like that old adage, right? Like knowledge is power, right? And so for a leader, being able to have that information would inform the decisions that we continue to make. And where and how
yeah.
it almost sounds like you've got to be working. I mean, if I'm a specialist or a clinician, that's tuning in as well, they've got to work in tandem with you in some capacity. They've got to have a place in the health center as well as being out and in the dining hall or the field or the waterfront
Mhm.
or right, like everybody's got to kind of have that. That's part of that ecosystem work. So
Yeah,
yeah.
that's really what one of the initial thoughts that I had when I first got to camp about that sort of standardization being key is that we can't work in silos. So,
Hmm.
camper care and the health center, they can't work in silos. They have to work together. There's such huge intersection. And it's a disservice to not have them, you know, be be in tandem with each other, working together. Um, I
So,
also
so
want to say that using the data to guide triaging and anticipate timing in terms of high volume periods. This is something that was interesting for me. Is
mm,
that um, even in terms of like when I looked at our medications for our health center in our camp, breakfast med passes and nighttime med passes
huh.
way busier than lunch and dinner. Okay, so this, you can't plan for what you don't know, you can't improve what you don't know. Seeing those numbers was really interesting for me. Okay, great. Let's staff those to the breakfast and nighttime meds differently than we do lunch and dinner. I mean, the data is showing that that's where we can redistribute our staffing and where our needs, morning and night
Mm.
are different.
Yeah,
Um,
that's an amazing thought and recommendation. Like, what are we doing around those two windows of time to be able to change the camper care as a result of what staff as a team can be doing to work through that? What would
yeah,
you
and
say?
from
What would
yeah.
Good, good.
Sorry, I could just talk about this forever, so I
No, it's
apologize.
great. I love it. I love it.
But I also think that leadership can, I didn't mention this before, was sharing the data with your leadership. This is also important because we can use the trends to show leadership that transitions of care tend to be a highly stressful place. I know Barry Garza's done amazing work on this transition of care. And so mapping out what is that? Well, first of all, what is a transition of care? Okay, so that could be the first drop off day. That is 2 weekers. Well, I'm just using my camp as an example. 2 weekers are leaving. All right. Then we have the end of the first session and visiting day, and then new campers come. All of these are transitions in ways that camp changes for the campers that remain there. And
Right.
so, what are these transition points, and how can we support our campers and staff, especially during those transition points, which have been evaluated as highly stressful times?
Yeah, I mean, I just think about it in any time for me as an adult. I was just talking with one of our care team members the other day about transitions, what that looks like for someone who's providing care to another child and my own kids, right? Versus where and how I'm watching them experience it versus how I'm setting them up for that experience. And so, yeah, Dr. Garst's work around that transition of care from thinking about an educator, during the school year to where and what information we have being captured. It's a significant part of the process.
It
I'm
is.
I'm really curious as we're having this conversation. Something that I often hear within the work, and I'm sure you've heard it too. Uh, not everybody has somebody in a full time capacity the way in
Mhm.
which Camp YJ does for you, right? And so that that's because of resources. And so some of
Yeah.
what you're talking about here, even in the summer months, let alone the non-summer months, when we're looking at this work, when we're doing all of planning and preparing, what suggestions do you have for camps with maybe a little bit less capacity, or they don't have or share the same resources? I mean,
Mhm.
I know that some participated in the study from what I've read and seen, but what guidance would you offer to them?
So I think again, start small. I wouldn't take on all of it at once. I think prioritize which metrics require, say, minimal data entry. So if
Okay.
there's, again, I'll use something that's familiar to my camp is we use a system, a computer system. You don't need to reinvent the wheel. You can run reports through that already. So
Mm-hmm.
we don't need to, you can't always pay someone to spend more time looking at the data. Just run the data,
Mm,
or run the report on data that you've already collected without even realizing you've already collected it. So that's
yeah.
an easy place for camps that have limited capacity or resources. That's an easy place to start. Um, and integrate tracking into existing workplaces, existing sort of workflows. So if you're doing, say, sick calls, we call them sick calls, or clinic hours, some people call them. If you have just like a check sheet, like, okay, so this camper saw, oh, yep, URI. All right, this camper has a twisted ankle, oh, orthopedic. So workflows that you already have established, just adding in something simple to that workflow is a great place to start too.
Mm. I just love that there's a way in which where you're coming from in the responses that you have in terms of ways in which you can change different workflows or track different pieces. the data is informing where you're coming from. And so I believe there's a lot more for all of us to continue to learn in some type of community setting. But I'm wondering, just from a more of a relate standpoint, as we kind of near the end of our time, and I have a couple of kind of conclusion oriented questions, but to relate a little bit more, is there a way that you can share a story or a moment that started to shift your thinking to bring you to the place where you are at this point?
Yeah, I think that one that really stands out is in, say, the summer of 2024, we
Hmm.
had a large number of upper respiratory infections, like a large number. Um, and I know that that was universal at many camps. I found out after the fact. In the middle of it, you're just like, oh my God, why is everybody coughing? Um, and we saw it firsthand, but the enormity of that upper respiratory sort of diagnosis that was going on was reinforced when I saw the data and when we broke it
Mm,
down by illness, say category. Um, I also trend it by like what's happening what week, and it was very clear that there was a direct link between activities that were happening
yeah,
and the increase in illness. And so
amazing.
yeah, for the next summer, we created some policies and systems in place for that changed bunk coverage and how we provided, coverage at night, and how often, counselors had like late night parties for their campers, which involved staying up late. So we had some interventions around minimizing or mitigating, stopping those, and we had hardly a fraction of the URIs the next summer, this past summer. It
Wow.
was a staggering decrease in illness, in specifically upper respiratory infection. So it was really a direct link between sleep deprivation and
Yeah.
your body's ability to fight off infection. And when you're communal living, things spread fast. And so it was really important to, when that link became clear, to enact or start interventions to
Yeah.
tailor that.
That's that's such a profound story.
And it
And
goes
thank you.
back to the
And
clinical part of things, but
yeah, I think what I appreciate most about it, and where you're coming from, and I'd go back to what you shared earlier in our time, that what you just acknowledged in the story is that the data helped you to make a modification, not to say, hey, you've done something wrong in the care that you're providing, but now there's a way in which we can make adaptations or adjustments that are going to be beneficial to those that we're providing care to.
yeah,
And so, I mean, just incredible, and something I think we can all relate with, right? Like, oh, something's taking place and happening, and so what are we going to shift, or what could we shift if we have the right perspective to look at it
exactly.
from a different lens. And so that's what you're doing in this, and I really really appreciate it.
Thank you.
I'm wondering, as we look to kind of close, are there a couple of actionable insights for our audience that's tuning in, for professionals, youth development leaders, healthcare providers, nurses? What are the closing takeaways that you have within the work that you're doing? Uh, and then I've got one final question for you after that.
Yeah, I think that quality metrics matter,
Mm,
and they create this shared understanding. They improve safety and they strengthen camper care. And so, looking at these metrics, the list of metrics that are coming out, is just looking at that as a starting point. Um, for future studies. It's something we can
okay.
use now, but also, again, going back to that springboard, I think that there's more we can do with this research. But at the
Okay.
end of the day, camper well-being it's not just about treating illness. It's about really the systems that we build and around preparation, around communication, staffing, and support. So when leaders invest in those systems, everyone benefits and there's healthier staff. Um, People feel more confident, campers feel safe, and the camp experience overall is stronger. So, tracking and expanding the understanding of data and of these consistent metrics is, again, that ecosystem. It just will help everybody else feel safe and supported, and improve the overall camper experience.
Yeah, and to be able to connect and then contribute in different ways. Look at that, a
Exactly.
little bit of Campbell sprinkled in at the very end for those that are tuned in and know what that is, and for those that are not, there's ways that you can engage and learn more, which is a big piece for me at this point. I'm feeling like, as you're saying, hey, there's a starting point for national alignment. I want to be like, okay, where can I go to learn more? Where are you at in the process of the work? Is there a document? Is there a spot where folks can sign
Yeah.
up to participate in future work? Is there something that you're publishing that is going to be coming out? Can you fill us in? Where can we
Yes,
plug in to
yes,
learn
yes,
more
yes, and
and
yes.
participate? Okay.
So I'm currently working on a manuscript for, that goes through the research and this study specifically, that will be submitted to a journal. So once that is published, I certainly can share, once that's published into a journal. Um, and I am always open to forming these connections with people that have a similar interest in this camp health space.
Okay.
So I think that there's a real opportunity to meet as a collaborative group of camp health professionals, and for discussion and brainstorming and having um, figuring out the path forward. It's a new path, and so I don't have a clear path, a clear guide right now, but I want to talk to anybody and everybody who feels similarly as I do about really professionalizing the space and furthering the research.
Yeah, our chief marketing officer, Kelly Farage, we were talking about this. She looks at it as, I think you don't need to have all of the things identified, Kate, in the path forward. You are changing the plot. You're writing a new chapter for us in the camp industry, and I'm so grateful for it. I know that for me, I first learned about your work on LinkedIn. So I think in the show notes, what we'll do is we'll make sure people can find you there, because that's how
That's
I
great.
saw that you were doing this work, and then asked Tracy and Barry a bit more about it and got to learn from you even more like today. And so you'll want to give Kate a follow on LinkedIn. You'll want to maybe tune in. We're going to look, I think, Kate, to figure out if there's a way that we can host a community meetup with ACH members at some point here as we come through the winter and spring. But thank you for the work that you're doing. Thank you for elevating care the way in which you are. Thank you for relating it to each and every single one of us that are tuned in today. We really are fortunate for your leadership and how you're pioneering and writing something new for us in the ways in which this goes forward.
Well, I feel similarly. ACH has been my sort of North Star since starting in the camp health space. So I can't say enough about the support and the guidance you guys have given me on this path. So thank you, to Tracy, to Barry, to Kelly, to everyone at ACH. I really appreciate the support and the opportunity to share this more broadly.
Thank you. Uh, Elevate and Relate is produced by the Alliance for Camp Health. The Alliance for Camp Health is a national 501c3 nonprofit and the leading authority on health and well-being for summer camps and out-of-school time programs. We prepare youth development leaders, healthcare providers, and behavioral health specialists to support youth well-being through research-backed, expert-led education, evidence-based practices, as we learned about today, and educational partnerships. You can join the Alliance for Camp Health as a member, and you can sign up for our free weekly newsletter, Elevating Care Weekly, through a link in our show notes. Together, with Kate and others, we're elevating care for healthier camp communities. I'm John Hamilton. Thanks for listening.